So, Dr. Bilski, I was doing some reading the other day. I do some reading every once in a while, believe it or not. And,
Public school education.
Just trying to better myself.
Exactly.
But prepless veneers. I read this term, and what on earth is a prepless veneer?
So, fabulous question, because we get this once in a while. So, prepless veneers, that terminology is like someone like myself, a doctor, a dental assistant, or dental hygienist, industry verbiage. We don't like to use that. Okay. So, we call it no drilling, no Novocaine veneers. So,
how do they work?
No, another great question. It's the basis of that is typically prepless or no drilling veneers means that you probably already have spacing, meaning your teeth, I'm going to exaggerate it with my fingers if you can see that in the camera here, and you have gaps between your teeth. So we can place veneers over the top, the front side of the teeth, without drilling on the teeth. Now there are some caveats to that. We have to look to make sure that your upper front teeth aren't too forward, because if our front teeth are too forward, it comes over the top, what's called the wet dry line of the lower lip.
He's a professional.
I am, a little bit too much coffee this morning. And what happens is you get the buck tooth look.
Yeah, okay.
All right, so if you're too far out and you have space, then you would be a candidate to use what are called clear aligners, the other term Invisalign. And we would want to shuffle those teeth back and move them a little bit inside the lip line.
Then do the prepless.
And then do the prepless veneers or the non-drilling, non-Novocaine veneers. And they're just bonded back on the surface of the teeth. There's nothing stronger to bond to than uncut enamel.
Wow, okay.
So no drilling. That's why we would want to do that. The bonding materials attached to that enamel, like you wouldn't believe.
Can I ask a question? If I'm a candidate for that, why wouldn't I? Is there any reason I wouldn't do a prepless?
So
do the old-fashioned way?
Yeah. So a lot of times patients have what are too much crowding. The teeth are overlapped.
All right.
And the only way that we can make it look pretty is that we have to do either a minimal drilling, moderate drilling, or a lot of drilling. So yeah. And honestly, dentists really, if we can get away with not having to drill very much. So the difference between the dentist that you go to would be well versed in that, and the other part of it is the reason why sometimes we should drill is that if you have cavities in the teeth already or old fillings on those front teeth, those have to be removed.
Oh.
And then in order to get the veneers to stay put, we have to do a little bit of a sacrifice.
Okay.
So if you have what are called shifts or cants, that would be, a cant means that your teeth are kind of leaning to the right.
All right.
Or left.
Or left, okay.
Whatever way, or you may have a combination of right and left teeth are just kind of malpositioned. Then that is a full reconstruction, which would require reshaping of the teeth, drilling, and maybe some laser gum lifts. When we're talking about the top, on the bottom would be lowering. But then you get comprehensive. So we always recommend, come on in. I take a couple pictures. We have what's called a white line template. It's like an overlay. I take a picture of your teeth, put the white line over the top of it, and I can show you where the gum needs to come up.
Wow.
If the teeth are too fat, too skinny, not fitting in that template, which is an industry standard that was developed by people that are non-dentists. They took a bunch of pictures of the movie stars and celebs of their teeth.
Really? Yeah.
And they said which ones are the most attractive, not showing them their faces.
Oh, no kidding.
So a lot of people will use Brad Pitt. If ladies looking at him, they're like, that guy's really cute. Who cares about his teeth?
Yeah, right.
But when you actually analyze the teeth, and you can develop what is considered handsome, pretty, attractive, this is that template that they developed. It's called the golden proportion. Wow. And we can use it, we can alter it, and we can change it. And then there's a little bit of math that we do. So we can dial that in. So if you do choose to move forward, and we know that your two front teeth is where everything is developed, we can send those measurements with the pictures and the template to the laboratory.
Wow. And
then they make your teeth, we come back, and then I can actually measure them prior to, so if they're not the right length and right width, the spacing's wrong, it goes back.
Boy, that's pretty amazing.
So there's not a lot of back and forth there.
It takes 2 trips then. I mean, in order to get this done, the first is, but yeah, well, but it makes sense though.
So you come in, we evaluate that.
Yeah.
We call that one appointment. The second appointment would be the no prep for the prepless
Okay.
veneers.
Yeah.
And we take either the putty molds, which we only maybe 5% of the time we do that, but typically now it's just using a camera. It's called digital impression taking. So no more putty. Send it to the laboratory, and it comes back rather quickly, usually within 2 weeks or less in a lot of cases. So, and then we have you in, no Novocaine. We bond those up,
Wow.
clean you up, and then you're biting into your apple shortly after we put your teeth in.
I love to bite in my apple. That's fantastic. Well, Dr. Bilski, thanks for sharing. Sounds really neat. And if this sounds like something you're interested in, Bilski Dental.
Come on in.